Hi, Paul Feuerstein here, technology editor of Dentistry Today. And I'm here today with a good old friend of mine. I don't mean old John, but...
it is old, Paul. It is been a long time, so that's okay.
John Cox.
How about experience?
Yeah, experience, a long experience. John Cox from Henry Schein. And one of the things we always talk about, and you know my focus is on technology, is the machinery that does all sorts of things, digital impression machines, combing machines. But what Schein has been doing is said, let's step back from the machinery and let's look at the entire workflow. And does it really matter if you're the fastest, the slickest, or whatever, or is there an end product that we want to get to? So there's a term that's come to me from John called ConnectDental. And why don't you give me a sort of an overview of what your process is going on here?
Sure, Paul. I think technology's always been at the forefront of dentistry for many years, as you know, and you've been wrapped around it for years, so you certainly understand that. What we've done is we've taken the software, so the practice management software, which is really the platform, and the platform that connects the laboratory to the dental practice. So it's a two-sided network that we're trying to connect. And the technology, everything that from 2D imaging to 3D imaging, whether it be CBCT and or intraoral impressions, connects, all that data comes into the practice management software, enables them to do more with it. So we're really enhancing the digital patient record. Some of the key elements of the ConnectDental story are it's an open platform.
Okay.
Whether the practice wants to add CBCT today, they want to add digital impressioning tomorrow, they want to bring in different components of technology and scale it over the 1, 2, 3, 4 years. And we enable them to do that and maintain the integrity of the information within the patient record. So it's archivable, it's accessible. It stores it with the patient file versus on a standalone device in the corner where you have to go and try and find it later.
So the goal is actually is the patient care, and in a sense it's sort of malleable and upgradable as you're working through this whole process.
Absolutely, and when we think of ConnectDental, we refer to three things. Everything the technology has to do to have relevance for the dental practice purchasing it, I think has to do three things. It's got to enhance the patient experience, so it's got to deliver a better patient experience than they're delivering today. 2, it's got to improve the predictability and quality of care that they're able to deliver. And 3, it's got to improve the efficiency and productivity within the practice. So if it can do all three of those things, then it's a home run for the practice, it's a home run for the staff, it's a home run for the patient in the quality of care.
So I think what we're trying to do here is step back a little bit. Like when I was making stereo systems, I'd buy one component from here, one component from here, and I had to stitch it together myself. And what you're saying is, you'll do the stitching for me. I don't have to worry about the individual pieces. I don't have to worry about how the whole thing works. And I know there's a term that Schein loves to use. It's called trusted advisor. So just to define that for me.
Well, no, I didn't know you were in the stereo business before, so that's that's interesting. So you're absolutely right. The trusted advice is, there's so much technology available today. And for a dental practitioner, you've got to decide what's right for my practice. So we'll help them make that decision. Make sure it does integrate. You talked about the components. The different components really have to integrate into the practice management software. If all it does is do the job but doesn't integrate with the patient record, then we're missing opportunity. And where the opportunity, Paul, it's not only today, it's where it's going to go tomorrow. So every digital record or every digital component, whether it's a digital x-ray, CBCT 3D, intraoral impression, it'll be used moving forward. I'll give you an example. A digital impression taken today and another one taken 6 months or 12 months from now, able to uncover tissue response, able to uncover tooth wear. See a 1 millimeter posterior tooth wear on a molar that otherwise you wouldn't be able to see, to communicate that visually with a patient.
So it's just like when I take my bite wings, I can follow them through over the years and just do a side-by-side comparison, because you're archiving all this.
Archiving and using it for diagnostic purposes moving forward, so establishing that baseline today is so important.
Now, let's just say I come to the Schein booth and I say I want to get this whole thing set up, and you say we can do this, this, and this. Is there a way I can learn how to use it in my office? Is there education? Is there anything that Schein will do for me?
Great question. I think one of the biggest challenges for practices today is, once they make that decision to purchase, is how do you implement it successfully. One of the keys is great training. So one of our promises to our customers is ongoing training. Number one, training them initially so they're confident and competent in the technology, using it in the practice and getting the return they're expecting. And then ongoing support, making sure that technology works, it's integrated, and it continues to work over time. So supporting that over time is very important.
And how about, I'm just being a little devil here, but what about if I have a change in staff? Is there a simple way for them to be brought back into the fold, new people coming into the fold?
Yeah, absolutely. We've got experienced technicians in the field that support our practices as well as our specialists, as well as support from our manufacturing partners. There's also an incredible amount of education that the practice can get online. We're seeing a lot of practice, and the education, I think, is a continuum. It's not get it all at once and it's done. It's a continuum where the staff continue to learn. Exactly.
People are coming to me and they say, I heard I could buy this scanner, I could buy this mill, I could buy this thing here, and how do I put it together? And I go, you really? It's a lot of work. So you're just taking that out of the equation completely.
Yeah, I mean, we take great pride in being that trusted advisor, as you mentioned earlier, and helping them understand what is the priority, what's the job they're trying to accomplish, what do they want to do in their practice today that they're really concerned about, and helping them establish a game plan. Put a plan together that implements what's the first priority, what's the second priority, and piecing that together for them and taking care of it, taking the heavy lifting away from the practice and making sure number one, it delivers what they want it to do, it's scalable, it gets them for the future, it doesn't become obsolete, and that links to our open platform system where we can plug in different technologies, and we have a broad portfolio of solutions.
It's a little overwhelming coming into the booth and seeing a couple of scanners, some cone beams here, all the different pieces of the puzzle, and it's confusing, let's just say.
Sure.
But so if the dentist wants to know a little bit more, obviously they can come to the trade shows, they can have their rep come to their offices. Is there anything online at Schein's website that would give them a little head start on some of this?
Yeah, I think the website has full of information, not only our website, our partners' websites. They can get plenty of information, not only in the solutions, how to use the solutions, and the benefits they bring to the practice and the patients in that clinical workflow. It's a complex time. There's so many new things coming on the market, as you know, but we've never been more excited about the solutions we're providing our customers and helping them make the right decision, making sure the installation and the use of the technology is getting maximized, and we have happy customers.
John, one thing I meant to ask you is, last year I was at the Greater New York meeting, and there was a very, very big pavilion that said ConnectDental, and all the puzzle pieces were in that. Are we going to see that again this year?
Yes, absolutely. We're excited. We're always excited about the big shows, and the ConnectDental Pavilion will be in place once again this year. We're going to have a lot of digital impression going on. We're going to be inviting our customers to come and put it in their hands. And if they haven't had the opportunity to take a scan with our different various options. So we're excited.
So you can literally, I remember you could actually walk through the workflow. It was really kind of clever.
Absolutely. We're going to include some thought leader interviews in the booth. We're going to try and put a scanner in every dentist's hands.
That's great.
And give them the experience of why move digital, why replace that 6-minute uncomfortable moment of impression material in a patient's house with a digital scan.
It's actually down to a little shorter than 6 minutes.
Okay.
But
3 minutes.
John?
It's a thrilling time.
This is a great day.
Yeah.
Pleasure speaking to you. Always good seeing you.
Always a pleasure. Enjoy Denver, enjoy the mountains.
Hey, thanks a lot.
All right, thank you,
All
Paul.
right, take
Pleasure.
care.